What if I told you that a simple gel, yes, just a gel applied directly to the penis, could help you achieve an erection in as little as 10 minutes? No prescription, no pharmacy awkwardness, no waiting for a pill to kick in. Sounds almost too good to be true, right? Well, today we're diving deep into a brand new FDA-approved topical gel that's already changing how men address erectile dysfunction. But here's the catch. While it can be a game changer for many men, it's not magic and it's not for everyone. So, before you rush out to buy it, let's separate the facts from the hype. And real quick before we start, if you value honest, no-nonsense men's health advice, hit that like button, subscribe, and drop me a comment below telling me where you're watching from. I love seeing our community of men from all over the world come together here. Here's something important. Erectile dysfunction is not just about the penis. For years, men have been sold the idea that it's purely mechanical, just a plumbing issue. Take a pill, fix the pipe, problem solved. But the truth, erections are the result of a beautifully complex symphony involving your brain, nerves, hormones, emotions, and yes, blood vessels. When even one instrument is out of tune, stress, blood pressure, low testosterone, prostate changes, performance can suffer. That's why I always remind my patients, ED isn't just a bedroom inconvenience, it's often an early signal of cardiovascular health. It can whisper to you that your blood vessels aren't working as well as they should. So when something new like this gel comes out, my job is to help you understand not just how it works, but where it fits into the bigger picture of your health and confidence. If you're new here, hi, I'm Dr. Narita, a board-certified urologist with 12 years of experience helping men reclaim their vitality, protect their prostate, and strengthen both their health and their relationships. I've sat across from thousands of men in my clinic, men in their 40 seconds, 50 seconds, 60 seconds, and beyond, who quietly struggle with ED, but don't always feel comfortable talking about it. So consider this video your private consult from me to you. We're going to talk openly, honestly, and without judgment. Now, let's break this down into 3 essential parts, because before you even think about trying this gel, you need to understand how it works in your body, what the science actually says, the risks, benefits, and practical realities. So, what is this new gel? It's called Erections, a topical treatment you apply directly to the glands or head of the penis, just a pea-sized amount gently rubbed in for about 15 seconds. What happens next is fascinating. First, you'll feel a cooling sensation, then a gradual warmth. That temperature shift isn't just cosmetic, it stimulates the nerves in the glands to release nitric oxide. Now, if that phrase sounds familiar, it should. Nitric oxide is the chemical spark that initiates an erection. It relaxes the smooth muscle inside the penis, allowing blood to rush in and create firmness. Think of it as flipping the body's own on switch. Here's the key though. It won't give you an erection on its own. You still need arousal. In other words, the gel primes the system, but you and your partner or your own desire still provide the fuel. Biologically, that's a good thing. It means it's working with your body, not overriding it. All right, you're probably wondering, does it actually work? Let's look at the research. In 2023, the European Society for Sexual Medicine presented results from a trial comparing with tadalafil, better known as Cialis. Over 100 men with varying degrees of ED participated. Here's what they found. 61% of men using Erections reported a meaningful improvement in erectile function. For tadalafil, the number was 87%. Now, that doesn't mean tadalafil won and Erections lost. The point is, Erections clearly works, especially for men with mild to moderate ED. Another fascinating study called FM57 looked at over 1,000 men across 60 clinics, even accounting for the placebo effect, which can be as high as 40% in ED studies. Erections still came out ahead. Here's the headline. About 60% of men achieved an erection within 10 minutes of applying the gel. Compare that to Viagra or Cialis, which typically take 30 to 60 minutes. That speed is a big deal for intimacy. No more waiting, planning, or breaking the mood. And because the gel acts locally, it doesn't flood your bloodstream, you don't get the same systemic side effects. No flushed face, no pounding headaches, no risky interactions with heart medications. So what about side effects? In the clinical trials, only 4% of men reported mild issues like a headache or nausea. Compare that with nearly 20% for Topical. And importantly, there were no serious side effects reported. Practically speaking, here's what else you should know. Safe with condoms doesn't break latex. Safe during oral intimacy won't harm your partner. Compatible with nitrate medications like nitroglycerin, which are dangerous with Viagra or Cialis. That last one is a huge game changer. Until now, men on heart medications simply had no safe ed option. But let me be clear, it's not a magic bullet. About 40% of men in the trials didn't respond. If your ED is caused by advanced vascular disease, nerve damage from diabetes, or very low testosterone, this gel may not fix the root problem. And that's why I never want men to think, if the gel doesn't work, I'm broken. No, it just means we need to dig deeper and address the underlying system. If you're dealing with mild to moderate ED, if you can't take pills due to side effects or medications, or if you just want something faster and less systemic, yes, Erection is worth considering. But here's my professional advice. Don't stop there. Think of this gel as one tool in your toolbox, not the whole solution. Combine it with a heart-healthy diet that improves blood flow. Consistent exercise, especially strength and pelvic floor work, stress management because high cortisol kills testosterone. Regular prostate checkups because your prostate health directly impacts performance. And speaking of the prostate, many men don't realize that as the prostate enlarges with age, it can quietly undermine erections and urinary flow. That's why I often recommend targeted supplements with ingredients like saw palmetto, bedtosterol, and pygmium. They don't replace medical care, but they can support long-term prostate health alongside lifestyle changes. Now, I want to pause here because I know some of you might be listening and thinking, Doc, it's too late for me. Maybe you've struggled for years. Maybe you've avoided intimacy out of fear of failure. Let me tell you something I've learned in 12 years of sitting across from men just like you. It's never too late to reclaim your confidence. I've seen men in their 70s, even 80s, rediscover intimacy after years of silence simply because they finally found the right approach. Erections are not just about intimacy. They're about dignity, about feeling like yourself again, about closeness with your partner and pride in your own body. So whether you try this gel or not, don't give up. You are not broken. You are adaptable. And your body is capable of more than you realize when you give it the right inputs. So here's my challenge to you. Don't just chase quick fixes. Build a foundation. Support your heart, your hormones, your nerves, and yes, your erections. And if something like this gel gives you a boost along the way, great, use it. But remember, the real victory is knowing you're investing in your health for the long haul. Gentlemen, your best years are not behind you. They can still be ahead, full of comfort, freedom, and confidence. If this video helped you, please give it a like, subscribe for more Straight Talk Men's Health advice, and share it with a friend who might need encouragement. And now I want to hear from you. What do you think? Would you try a topical gel like this? Or are you more comfortable with the traditional pills? Drop your thoughts in the comments. I'll be reading and responding.